Cuba is as a model for healthcare reform. Well, we'll see. It is a poor country, but it can boast about healthcare, a system that leads the way in Latin America. So what are they doing right? CNN's Morgan Neal takes a look at the good, the bad of Cuba's healthcare system.
Is there a doctor here in Cuba?
When Michael Moore's film Sicko came out in 2007, the debate it sparked put Cuba's healthcare system under the microscope. Cuba supporters gleefully pointed out that the poor communist island gave its people universal health care, something the United States doesn't do. Critics charge that conditions in Cuban hospitals are appalling and that Cubans had to pay bribes to get decent care. How does health care work in Cuba? It's not an easy question to answer, but there are some impressive statistics. According to the World Health Organization, Cuba's life expectancy is 78 years, the same as Chile and Costa Rica, and the highest in Latin America. And its infant mortality rates are the lowest in the hemisphere, in line with those of Canada. This clinic in Managua, a community outside Havana, is one of the country's newest and best equipped. It serves a population of some 15,000 people. The director tells us under one roof, she has dentists, general practitioners, physical therapy, homeopathic medicine, and a laboratory that makes vaccines.
Built just 5 years ago, this clinic is really a symbol of what Cuba wants to do with healthcare all over the country. You can see the machinery is new, the walls freshly painted. It's an idea of where the country wants to go, the future of its healthcare.
All of it free of charge. How does Cuba do it? First of all, the government dictates salaries. Doctors earn less than $30 per month, very little compared to doctors elsewhere. And priority is given to avoiding expensive procedures, says Gail Reed, who's lived and worked in Cuba for decades.
They concentrate on prevention. They concentrate on bringing services closer to people's homes so that the big ticket items don't really don't sponge up all that small budget they have.
But Cuba's system certainly has its problems. Many hospitals and emergency rooms are decrepit and even unsanitary. Equipment is frequently old, and patients often supply their own sheets and food while in the hospital. Health officials admit the system isn't perfect, but they say no one falls through the cracks. Morgan Neal, CNN, Havana.